Greetings. It is December 2nd, 2010, and I have a question for you. Is healthcare insurance a business? Is it a perk? Or is it a right or a privilege? What do you think? Well, that's a topic for today's show and for this video. And for those of you who don't know me, my name is Michael A. Weiss, and I do this video blog / podcast sort of once a week, and oftentimes I take this video and I put it up on CNN on the reports when it's relevant. And in this particular case, I think it's relevant because it's about healthcare reform. Because I think healthcare reform must start at the perception problem. And I'll explain what I mean by that. Now, for those of you who don't know who I am or who are sitting there thinking, who is this guy and why does he think he knows all the answers? I don't know all the answers, but I've been through a lot, so I could just share my insights and hopefully that could be thought-provoking to other people who may know all the answers. What do I mean by that? I'm 47. I've had a chronic autoimmune illness called Crohn's disease for about 25 years. It's been a rocky road. I've had about 17 major surgeries, been in the hospital almost 200 times. Actually wrote a book. Confessions of a Professional Hospital Patient. It's a very funny book that's very fair to medical professionals, but it chronicles what it's like to be a chronically ill patient, both in and outside the hospital. And I have been told by people that it's a great read for patients, for their families, and for others who want to get a feel for what it's like to have to go through this healthcare system. So if you can and you want, check it out. I think you'll dig it. A lot of people, I never got one bad response, unless someone bought it thinking it was a James Bond book, and it's not. So check it out at Amazon, Barnes & Noble, or on my site, which is hospitalpatient.com. Okay, so what is healthcare insurance? Number one, is it a perk? Well, I'm 47, so my working adult life, it was a perk. It was like, hey, Mom, Dad, I got this job. They offered me 50 grand plus benefits. I get healthcare insurance, and the value of that is blah, blah, blah. I think that's how it started. And then other companies had to compete, and then it sort of just took off. And then the government started passing laws like COBRA, where the company has to offer you insurance for like 6 months or a year after you leave their employ. Somehow, entrepreneurs and small businesses became the source of healthcare insurance, and I don't understand how that happened. It was just a perk. It was no different than them saying 50 grand and a car. Well, then what would happen then? Would it be like I never have to buy a car? Whoever employs me has to give me a car? Well, that's what we've done with healthcare insurance, and I think that perception needs to be changed, because having to provide healthcare insurance as a small business has become an albatross for these entrepreneurs. And I think President Obama, while extremely well-intended, and I give him tremendous amount of credit to go through all the adversity he did with trying to pass health care reform, I think he just applied ideas to a system that doesn't work. We need to go back and come up with a new system, because relying upon small businesses to provide health care insurance doesn't work. The government needs to play a bigger role. Now, two, is it a business? Of course it's a business. It's a billion-dollar business. From the medical professionals who provide services to the companies that provide all these technological gadgets and products and new tests and medicines and the pharmaceutical, it's a business, okay? The problem, and I've been told this by doctors, they are reluctant to embrace technology and our new economy because they see it as quote-unquote redefining their profession. Now, I understand that. I'm an attorney. I was trained as a lawyer, and I practiced for 10 years or so. When I practiced, they invented the fax machine and voicemail, and it really changed how you practice law, because people could leave messages for you knowing that, okay, I left it for Michael Weiss, he's got to get back to me, or I faxed it. It was sort of like a one-ended communication, and then I had to do what they said or at least get back to them. You know what? But prior to me, though, there were no computers, so I don't even know how lawyers existed, having to write motions and make changes with carbon paper. But somehow they did. It's just called progress. So I don't understand why doctors don't just embrace it and move forward. They embrace advancements in diseases, in the polio vaccine, in treatments for cancer. They embrace all of that, but they're not embracing this. I don't get it. I don't get it. I do understand their ethical hesitation in having their craft redefined. I really do. And I respect those doctors because they take that craft very seriously. But what they're missing here is that this is a golden opportunity for doctors to take back control of the medical profession, which is now given to health care insurance companies and pharmaceutical companies. They don't see that. They have to. They need business affairs people to help them see that. So I hope that is what happens, okay? Now, if it is a business, and it is $1 billion business that's run on handwritten notes that no one could read, but soon we're going to have sort of electronic medical records which will standardize everything and everything will become more efficient. But that's going to make patients consumers, and I think that's going to change the whole system. And what do I mean by that? Patients as consumers will be entitled to accountability. Medical professionals have to be accountable. Now, some of you out there may say, hey, they already are accountable. If they screw up, you could sue them. That's not what I mean. I mean they have to be accountable to the quality or the type of services they provide. Hey, I may not like the bedside manner of my doctor. I may choose a different doctor. I may not like the way my doctor runs his or her practice. I may not like how they talk to me. I may not like how they don't listen to me. It's a business, and I think patients will benefit from it. I think medical professionals will benefit from it. The problem is patients hold doctors in way too high of esteem. And I don't say this to demean doctors. I have the utmost respect for them. They're very smart. They've worked very hard. They're entitled to everything they get. All I'm saying is that patients go way beyond that. You know, it's sort of like that scene in The Sopranos, if there are fans of that show out there, when Uncle Junior had that Dr. Kennedy, and anything Dr. Kennedy said was gospel to Uncle Junior because he was a doctor. It doesn't work that way anymore. It can't, because if you let it work that way, doctors become vulnerable. They become prey to pharmaceutical companies who say, doctors, they have a captive audience of patients who will listen to everything they say. So we're going to ask this doctor and that doctor to sort of push this drug and that drug. Now, of course, the doctor has to make a decision whether they want to do it or not. That's not what this is about. What this is about is patients being consumers. Take away that temptation. Doctors and other medical professionals are under enough pressure as it is. The system's broken. It needs to be fixed, okay? Now, the last aspect of this four-pronged analysis is healthcare insurance a right or a privilege? Now, some would say it is. Some people born into other societies get that. Now, someone with a chronic illness like myself, I wish it were. But there are other people who are very healthy, maybe very wealthy, who say, look, I don't want my tax dollars paying for Michael Weiss's health care. You know, but that old saying, but for the grace of God, there go I, or, basically, that could be me if I didn't get a couple of breaks. People really need to heed that, because cancer, God forbid, or a major health disaster is right around the corner. And I think people can't think like that. We're a nation that have become haves and have-nots. And our recent economic collapse, I think, has changed that. I think 9/11 changed that a bit. But we need to come together as a community. We need to understand that, hey, if I don't use the highway, I can't say, well, I'm not paying for that tax. We all pay taxes so that our society works as a whole. In terms of police and fire, health is the same. So, in some ways, I guess what I'm saying is, it is somewhat of a right or a privilege. But I do understand that it's a business. So I guess I will end my sort of analysis with, I think it's very much like the way television works. The FCC regulates communications. It's getting a little tricky for them now with the internet and whatnot, but look at HBO. The FCC says you could have basic TV for free, or if you want cable TV, you have to pay. If you want HBO, you got to pay more. If you want DirecTV, you have to pay. There is a regulated system, and I think that's where we're headed. I think the government has to get more involved. Medicare, Medicaid, some will say they work great, some will say they could work better. The bottom line is the government needs to get more involved. They can't just try to sort of fix a system that's broke. It makes no sense. It's like building on top of a piece of, like a structure that's broken. Knock down the structure and build a new structure. That's what we need to do. So I would love to hear from people to see what they think about this video, or maybe what do they think about health insurance. What do you expect? Do you expect it from your employer? And if you do, Do you wonder why? Where did that come from? Who told you about that? When you think about it, if you were the entrepreneur, does that make sense? Or is it a right? I mean, are you healthy and do you resent having to pay for someone like me? I have thick skin. I could take it. So send it along. You could contact me at hospitalpatient.com. And again, the book is Confessions of a Professional Hospital Patient. It's filled with more wacky analysis like this, but it's funny, or funnier. And on Twitter, my name is Hospital Patient, and I guess my email address also is michaelweiss@hospitalpatient.com. So I thank you for listening, and I look forward to hearing your thoughts. Thanks.